My name is Subbarao. I am a medical student. What's your name?
Sai Chandar,
How old are you?
21.
Okay, now I am going to examine the cardiovascular examination. Is that okay to you?
Yes.
Okay. Uh, can you place your hands like this? Okay, I will check. Reverse. Okay. Relax. Okay, now can you keep like this position? Okay. Okay, relax. Okay, now I am going to palpate the radial pulse. Okay, now I am palpate on both sides. Okay. Now I am going to check the brachial pulse. Okay. Okay. Now. Okay. Now I will check the neck. Can you turn on your head on the left side? Left side. Full. Okay. Relax. Now I am going to check the carotid pulse. Okay. Oh, I check the apex of the heart. Okay. Now I check your tummy. Is it pain?
No.
Okay. Now I check the valves. Four valves of the heart. Now take a deep breath. Okay, relax. Okay, you are normal sounds.
Hello, myself Vishal Kumar. I am going to examine the cranial nerve 5, 7, and 8. The cranial nerve 5, that is the trigeminal nerve. I will start with, I will palpate the temporal and masseter muscles. Can you please kindly clench your teeth? Okay. After clenching the teeth, I will check the strength of the muscles. Now, can you open your jaw and move just side to side? Now I will look for the facial sensory loss. Kindly close your eyes. I will use this blunted object on the forehead, on the cheek, on the chin. Can you please say if stimulus is sharp or light?
Sir.
Okay. If the stimulus is light, we should use the temperature sensation with the two. Now I am going to inspect the facial nerve, that is the cranial nerve 7, during the conversation as well as in rest position. Kindly raise your eyebrow. Okay. Kindly show your anger face. Close both eyes tightly, and I will try to open. Now the nerve is intact. Show both upper and lower teeth and smile. Now it show a normal facial nerve. Now I am going to examine the cranial nerve F, that is the acoustic or vestibular nerve. I will whisper on one ear while closing the another ear. You have to repeat the sentence.
56, 75.
Now you can say vestibular or acoustic nerve is intact while having. If there is a problem, just look for the sensory loss or any other loss. The elbow flexion and extension. For the flexion C5, C6, biceps and the brachioradialis, and extension C6, C7 and C8. triceps at the elbow by having the patients pull or push. This is flexion, this is called extension. To test the wrist extension, C6, C7, C8 radial nerve extensor carpi radialis and the brevis. I will force here on your wrist, and you have to resist against my force. So he can able to resist against my force. The wrist extension is intact. Now I am going to test the finger abduction test with the palm down, and the finger are spread, and I will try to make them together, but you have to resist, right? This so the finger abduction is intact. Next test is to test the grip strength test. So for this I will put my index finger and I will ask the patient to squeeze them, and I will use the another hand to just get rid of hurt. So I will, don't let me go this finger, okay? This test so that the hand grip strength is intact.
Before starting the examination, start with the hand wash or sanitization of the hand.
Good morning. Today we are going to perform the cranial 9 and 10 examination. Okay. Now we are going to start the procedure of the cranial 9 and 10 examination. Observe the patient for any abnormalities in articulation and pronation. After the observation of the pronunciation, do you have any speaking problems, like any swallowing problems or speaking problems? Okay. After the observation, we are going to observe the vulval position. It should be in the midline. Open your mouth. Can you please lift your head upwards? Okay. Now look into the palate position of the patient. Can you please say ah? Now we are going to perform the GAR reflexes. Use the tongue depressor. Stimulate the pharyngeal mucosa. Open your mouth. Okay, now we are going to perform the cranial 11 examination. Can you please turn your head towards one side? Can you please resist my hand? To perform the shoulder examination. Okay, I'm going to palpate your shoulder. Okay, can you please elevate your shoulder upwards? I'm going to just need to resist my hand. Okay. Ask the patient to protrude his tongue up. Can you please protrude your tongue? Look for the asymmetric atrophy and diversions from the midline. Can you please move your tongue side by side? The movement should be smoothly performed and rhythmic in character. First one is the biceps reflex. Okay. Can you please flex your hand? Place the hand. Okay. Now we are going to perform the triceps reflex. Okay. Can you please flex it? Now we are going to perform the brachioradial reflex. Okay. Can you please flex your hand? I am going to reflex on the 1/3 of the wrist. Okay. Okay. Now we are going to perform the knee reflex. Okay. reflex. Okay, can you please sleep clearly? Now we are going to perform the Babinski reflex. Okay, we will perform the closed test, closed reflex. Okay. Yeah. Okay.
Hi, I'm Varsika and this is my patient. What's your name and your age?
Prashant 17.
Can you please hold your hands like this, right? And bend it here. Inspect the eyes. Can you please look for front? Okay, I'm going to inspect your eyes. Okay, I'm going to pull your lids down. Inspect the mouth. Can you please open your mouth? Okay, you can close it. Palpate the lymph nodes. Inspect the chest and the abdomen. Palpate the abdomen. Light palpation. Deep palpation. Palpate the liver. Palpate the spleen. Follow the kidney. Palpate the aorta. Percuse the border of the liver. Percuse the splenic border. Percuse the access for the suprapubic bladder. If you suspect ascaris, assess for shifting dullness. Can you please slightly roll to your left side? Okay. Aspirate to assess vowel sounds. Assess for an aortic root. Assess for renal artery roots. To complete the exam, I would like to examine the hernial orifice and also a digital rectal exam.
Now we are going to examine the posterior of lungs.
Standing in midline position behind the patient, note the shape of the chest and how the chest moves. Deformities are asymmetry in chest expansion, respiratory movement on both sides. Palpate the chest, focus on area of tenderness and bruising, respiratory expansion. Note any palpable cavity, skin abnormalities such as mass or sinus. If your thumbs are developed 10th ribs, watch the distance between your thumbs as they move apart during inspection. Feel for the range and symmetry of ribcage as it expands and contracts. Percussion is one of the most important techniques of physical examination. Strike the pleximeter finger with the right middle finger. Apply more pressure with the pleximeter finger. Use the same percussion techniques in both areas. Percuss or strike twice in each location. Note the basic qualities of sound: intensity, pitch, and duration. Percuss one side of the chest and the other side at each level in ladder-like pattern. Thickness of muscles and bone alter the percussion notes over the lungs. Locate the area and quantity of any abnormal percussion. Auscultation is the most important examination technique for assessing airflow through a tracheobronchial tree. It involves listening to the sound generated by breathing, listening for any adventitious sounds and abnormalities are suspected. Always place the stethoscope directly on the screen. Clothing alters the characteristics of breath sounds and can introduce the friction and added sounds. Breath sounds are usually louder in lower posterior lung fluids. If the breath sounds seem faint, ask the patient to breathe more deeply. Shallow breathing or thick chest wall can both alter the breath sound intensity. Ask the patient to say 99 or trees. The whispered voice as they are transmitted through the chest wall. 99, 99, 99, 99, 99, 99, 99.
Finger nose finger test. Ask the patient to touch your index finger and then touch his or her nose alternatively several times. Move your fingers so the patient has to change the direction. Observe the accuracy and rapid alternating movement. Show the patient how to strike one hand on the thigh and raise the hand, turn it over and then strike it back. Ask the patient to tap the ball of each foot as quickly as possible on the floor. Note for any slowness or awkward. Show the patient how to tap the distal joint of the thumb with the tip of the index finger again as rapidly as possible. Observe the patient's speed, rhythm, and smoothness of the movements. The non dominant side often performs less well. Legs heel to shin test. Ask the patient to place one heel on the opposite knee and then run it down the shin to big toe. Observe this movement for smoothness and accuracy. Gait. Ask the patient to walk across the room, down the hall, and then turn and come back. Observe the posture, balance, swinging of the arms, and movements of the leg. Tandem gait. Ask the patient to walk down from heel to toe in a straight line. The examiner should remain near the patient to prevent injury in case of the patient begin to fall. Walk on toes. Walk on heels. Hop in place, one leg at a time. Romberg's test. Position sense. Ask the patient to stand with the feet together and eyes open and closed for at least 30 to 60 seconds without support, feeling steady. Sensory function. Ask the patient to close his or her eye. Note the patient's ability to perceive the sensations being tested. Primary sensation. Superficial tactile sensation. With the fine wisp of cotton, touch the skin lightly, avoiding pressure. Ask the patient to respond whenever the touch is felt. Superficial pain. Following a similar procedure, alternately use a dull or a sharp part of a big safety pin. Lightly prick the area of the skin. Ask the patient to respond yes upon feeling the pain. Sensitivity to vibration. Place a vibrating tuning fork over the bony prominences, that is shoulder, elbow, wrist, iliac crest, knee, ankle, or spine. Note the ability and feel the vibration. Point sense. The fingers and the toes are moved passively, and the patient is asked to indicate the position and should hold the finger or toe at their sides. 2-point discrimination. Ask the patient to close the eyes and extend their arm in front of the examiner with two ends of an unfolded paper clip. Ask the patient if one or two points are touching him. Point localization. Ask the patient to point the spot where he was touched. Aphasia. Ask the patient to extend their arms, take a blunt object's end, and draw shapes or write alphabets on the skin. Ask them to identify. Extinction phenomena. Use your index fingers simultaneously touch both sides of identical areas in the body.
This is Ritwik. May I know your name?
My name is Joe.
And age?
20 years old.
Okay, now I am going to check your blood pressure. Is okay with you?
Okay, now.
Okay. Can you stand eyes? Okay. How did you came here?
By walk.
By walk, okay. Not for states, right?
Yeah.
Okay. Did you take any coffee or
No.
smoking? You smoke? Any medication?
No.
Okay. Now I'm going to check your hand, palpating near the brachial artery. I'm going to check your place. Okay, Vivek, place your foot on the floor and sit relaxed. Okay. Okay, Vivek, can you place the hand here? Okay. Now I'm placing the cup 2.5 centimeters above anticoagulant profile.
Start.
Now I'm checking the tightness of the cup by placing two fingers inside the cup. Now I'm going to place these two pipes between the brachial artery. And now I'm going to palpate your radial artery. I'm going to inflate the cuff till the radial artery disappears. This is the systolic pressure. Relax the cuff slowly 15 to 30 seconds. Okay. Okay. Now I am going to place the belt on the brachial artery. Now I am going to inflate the cuff 30 mg above the systolic pressure. Now I am slowly deflating the cuff 2 to 3 mm per second. Now I add the first narcotic sound at 110. This is systolic pressure. Now I am slowly deflating the cuff continuously. Now I disappear the sound. This is diastolic pressure at 70. Now we have to record the measurements. Thank you.
Hello everyone, today we'll make eye examination. What's your name?
Renu Prasad.
Okay, what's your age?
I'm 18 years old.
Okay, is this okay for you?
Yes.
Okay, now we'll perform a first test, that is visual acuity. Now close your left eye and spell the words.
E P V T O Z.
Okay, now close your right eye and spell the words.
E P V T O Z L P E D E F Z T O.
Okay. Perform second test, that is near vision. Now close your left eye and spell the words.
All tropical and subtropical fruits are grown in this region. The parts are Bihar, Assam, Meghalaya, parts of West
Okay,
Bengal and
now
UP.
close your right eye and do the same.
Classified into 4 regions: temperate, low winter temperature, dry temperature, high cold conditions.
Okay, great. Okay, now we'll perform third test, that is visual fields. Now close your right eye and see my nose. Can you see like any blur or double vision?
No.
Okay, now close your left eye. Now, can you see any blur or double vision?
No.
Okay. From fourth test, that is peripheral visual field. Now close your right eye. See straight. And can you see my fingers moving?
Yes.
Okay, now close your left eye. Can you see my fingers moving?
Yes.
Okay, perfect. Okay, now we'll assess the eye movements. Move your eyes according to this pen. Okay, perfect. Okay, now do you have any questions?
No.
Okay, thank you.
My name is Vikas Paraksan. I am here for examination of shoulder and wrist. So we are going to inspect the shoulders, and we are going to inspect the counter of shoulders and shoulder girdle, clavicles, scapula, and subluxation, crepitation. And now we are going to for palpation, palpate the joint space, bones and muscles, not for tenderness and anything deformities and any swellings. We also detect sternoclavicular joints and biceps tendons. Now we are going to perform some range of motion. Firstly, like a forward flexion, and next hyper extension. Now we are going to conduct the abduction and adduction, and now we are going to perform the internal rotation, and now for external rotation. Now we are going to perform some special maneuvers, like firstly crossover abduction test from both hands, next apply scratch test, next near impingement test, and next one Hawkins impingement, next the drop arm test, next for empty can test, next infraspinatus test. Now we are going to perform hand wrist examination. Firstly inspection. We should inspect any swelling, erythema over joints, deformities, muscle atrophy and all. Now we are going to palpate the joint of the wrist, palpate radiocarpal joint and metacarpophalangeal joints, and distal interphalangeal, post proximal interphalangeal joint. We also perform some like a medial and lateral aspect of PIP and DIP, interphalangeal, proximal interphalangeal joints. Now we have to perform some maneuvers like range of motions. Firstly radiocarpal joint, the flexion of palm, extension, now ulnar deviation and radial deviation. Now we have to perform some PIP and DIP joints motions, flexion, extension, abduction and adduction. Now we are going to perform thumb movements, flexion, extension and abduction. So now we are performing some special maneuvers for carpal tunnel syndrome. The first one, like tunnel sign. We percuss the medial side of palmaris longus tendon. Tinning sensation in palmar aspect is positive result. And next one we have Phelan test. We are going to Press the back of both hands together to form angles.
Examination of the oral cavity. First, lips. Inspect the inner surface of the lips by retracting them with a tongue blade. Inspect for color, moisture, lesion, symmetry, deformity. Inspect the buccal mucosa using a tongue blade for color, pigmentation, ulcers, patches, and nodules. Then inspect the gums for any discoloration or bleeding and attraction, and then push in the margins of the gums, and then inspect the teeth. If there is any absence of teeth and discoloration and fillings, bridges and braces. Ask the patient to say like with the tongue protruded out. If not, press a tongue blade firmly to get good visualization of the pharyngeal wall. Inspect the soft palate, uvula, and tonsils for any exudates or swelling or ulcerations or tonsillar enlargement. Examination of the neck. First, inspection. Examine the neck anteriorly, laterally, and posteriorly on both sides. Is there any symmetry, deformity, mass, and swelling? Observe the patient should sit relaxed position and then examine head position tilted or rotated. Note the tone of the neck muscles too. Palpation of the posterior cervical spine and masthead process. Is there any mass is palpable? Describe its location, consistency, size, and mobility. Palpate the trachea for any deviation from its original position by placing your finger along one side of the trachea. If there is any asymmetrical, the deviation is on narrower side. Examine the lymph nodes from behind the seated patient. Using the second and third fingers, pads of both index and middle fingers move the skin over the underlying tissues in each area in a rotatory fashion. You can examine both sides simultaneously. Feel the nodes of preauricular, postauricular, occipital, tonsillar, submandibular, submental, and then deep cervical chain, supraclavicular. For the submental nodes, feel the nodes with one finger while bracing the top of the head with your other hand. Palpate the thyroid gland from behind the patient. If there is any mass noted, describe its location, size, and mobility while drinking sip of water.